Hello, my name is Javier, and this is my respiratory case study. Chief complaint: sore throat, cough, shortness of breath, weakness, chest pain, diarrhea, fever, back pain. HPI: 60-year-old male who presents to the emergency room this morning complaining of shortness of breath and chest pain, 5 out of 10 over the last 5 to 6 days, requiring supplemental oxygen. Patient goes to dialysis Monday, Wednesdays, and Fridays. However, he has skipped 2 treatments due to weakness and diarrhea. Patient reported fevers for 3 consecutive days. He took Tylenol to resolve fever with good outcome. Patient took a COVID rapid test with negative results at home. Patient is unvaccinated and refuses COVID vaccines. COVID PCR test done upon arrival, awaiting results. COVID PUI isolation in place. Past medical history: diabetes type 2, hypertension, end-stage renal disease, hep C infection, and cardiomyopathy. Family history: hypertension, throat cancer, stomach cancer, leukemia. Social history: former smoker, 1 pack per day, used tobacco, and just for alcohol use. This is a list of his medications. He has 2 allergies to lisinopril and metformin. Review of systems: he's positive for malaise and fatigue, positive for sore throat, positive for cough and shortness of breath, negative for hemoptysis, sputum production, and wheezing, positive for chest pain, 5 out of 10 during inspiration, not radiating, negative for palpitations, orthopnea, claudication, positive for leg swelling. It's positive for diarrhea, positive for myalgia, and he's negative for other systems. Physical systems: his vitals are 101 temperature, blood pressure is 166/90, heart rate is 120, respiration rate is 30, saturation is 90%, he's on 4 liters of oxygen, 5 out of 10 chest pain. He's sitting up in bed, uncomfortable due to back pain, alert and oriented times 3, respiratory rate 30 breaths per minute, talking in half sentences, use of accessory muscles for respiration. Perla, oral mucosa dry, no JVD, no bruits, diminished lung sounds, crackles on right lower lobe. His heart rate is regular, although he is tachycardic, S1 and S2 present. Bowel sounds are hyperactive, abdomen is soft, there are no rashes, his pulses are strong, capillary fills there, bilateral lower extremities bleeding edema +2. He has a hemodialysis fistula over left upper arm. Cranial nerves 2 to 12 grossly intact, no focal deficits. You can see his blood work. I just want to take into consideration that this is a dialysis patient who has missed 2 treatments. So that means that his electrolytes are going to be a little off. However, I want you to pay attention to his white blood cell count and his troponin. He also has an ABG. His pH is 7.31, CO2 43, PO2 174, O2 SAT 93, HCO 20.8. And here we can see his chest X-ray, which show evidence of multifocal bilateral airspace opacities, suggesting COVID-19 pneumonia. Patchy, confluent ground glass opacities and consolidations throughout the lungs, consistent with known COVID-19 infection. I guess we don't have to wait for the CPR test results or PCR test results. This patient is going to have a change of condition. The following day, patient was found gasping for air in the bathroom. Patient was on 4 liters of oxygen via nasal cannula. His saturation reading was 85%. Patient was placed on non-rebreather mask, oxygen up to 10 liters. He was assisted to bed in prone position. Patient was tachypnic in rapid AFib with RVR up to 150s. Patient stated, "I'm getting really tired." Patient continued to descend to low 80s and became unresponsive. So my question to you is, what do you think is going to happen next? What will be the next intervention? Discussion, three differential diagnoses for this case, common assessments, findings of one of them, a workup to rule in or rule out one of your selected differentials, existing prevention and therapeutic measures for one of your selected differentials. What do you think it will happen after the patient's change of condition? And if you could have done something different, what would have been your intervention? Thanks for listening and good luck.